Good evening all. Thank you again for joining us for this week's webinar, which is focused around building a successful career in pediatrics and Piku. My name is Rosanna. I'm one of Medimatch's nurse advocates, and I also work with HCA Portland as a neonatal nurse. A little bit about Medimatch. Medimatch is a brand new talent marketplace recently launched for nurses looking for roles in both the private sector and the NHS. And it works in that instead of nurses looking endlessly for jobs through the marketplace, we have them come to you. And how that works is through a really easy sign-up process, through a few simple steps. You fill in your requirements, upload your most recent CV, a profile is then built for you, and one of our nurse advocates will then reach out to you to confirm your preferences, and the matching process begins. Today's presentation is being presented by Lorraine Ridley and Karen Furlonger. Lorraine is a Piku nurse, Piku matron actually, and Karen Furlonger is a Pediatric Services matron. We'll have questions and answers at the end, so feel free to, if you have any questions during the webinar, put them in the chat box and we'll go through them at the end. Okay, over to you, Lorraine and Karen.
Thank you. Thank you. So I'm Lorraine Ridley, as Rosanna said. I work here at the Portland. I've been here for 7 years, so we'll start my presentation, please. So we're going to be, just so you know what we'll be going through, so we'll be going through my journey from student to matron, the challenges that I faced along the way, any standout moments, any advice. So that will be for me.
And for myself, the same. We talk about the career journey today and about becoming a matron and the obstacles that we've overcome, career highlights for myself, and any closing thoughts at the end of the this presentation.
So, okay, so over to me. So currently, as I said, I'm the paediatric intensive care matron in the Portland. I've been employed by the Portland for just over, well, it's like 7 years and a couple of days. So my anniversary here was the 20th of July. And I initially worked here as a sister up until September 2020. Prior to coming here, I worked at King's College Hospital in Camberwell, and I worked there for 14, nearly 15 years before deciding to fully move over to the private sector. So our specialisms on our unit, we have neurosurgical, cardiac, cardiothoracic, gastro, ENT, orthopedics, long-term complex needs, general intensive care, and spinal surgery. So we're a real melting pot. In most other centres, you would have specific neurosurgical wards, a cardiac ward, etc. But we're quite fortunate actually that we get a bit of everything. So it's never a boring day. I work very closely with the other paediatric ward managers, especially Karen, because her patients come to me, my patients go to her. So we have to work closely so that the patients have a seamless journey. Obviously the consultants, the international office, because we get a lot of international patients that come to us. The HCA concierge, again, they assist with international patients that are not from the Middle East. So we get, we've been getting quite a few referrals from there. Obviously theatres, yeah. So that's who we work quite closely with, really. We've just also started to have a plan with Tadworth Hospital, which is a neuro rehab hospital, because some of our patients, it would be better for them to be there than to be an inpatient in an acute ward. Next slide, please. So basically, I qualified in 2004. I was fortunate enough to get into my dream uni, which is the Florence Nightingale School of Nursing at King's College London. So once I was there, from my second year placement, I went to PICU. So when I started out, I wanted to be a health visitor, actually, and I knew you had to be a nurse to become a health visitor. I did my second year placement in the paediatric intensive care and knew that that's where I wanted to go. So I went there for my third year placement. So when you're in your pre-reg, your third year end placement, they used to call it, I don't know what they call it now, but in my day, it was called your destination placement. And you go there for 3 months. So I went there for my last placement. And in that time, I did a bit of research. Because at that time, King's would not take a student straight from university. You had to go on a rotation somewhere else before you could go into an intensive care. And so I went to, did my homework, and I saw that other tertiary centres that were similar to us were actually taking their students and growing them straight from uni. So I went back to the manager then and my mentor, and I said, I'd really like to come straight to the ICU. How would that happen? And they said, oh, we've never done that before. So, thankfully for me, the matron, when I showed her all of the research I had done, she went and spoke to the head of nursing, who basically told her that, okay, yes, I can come in on a permanent contract, but on her head be it. Thankfully, I made her proud. And they now do that as a regular thing. So now, constantly now, straight after me, they take new, freshly qualified students into the ICU on a buddy system. I went there and they took me from basically student to sister. So they grew me into the nurse that they wanted me to be, and I really had a good time there. So whilst there, because in that hospital, the specialisms were liver transplantation, neurosurgical, general trauma, just anything where a child would need multi-organ support. So I thought I'd go back to uni and go and get some courses to support what I was doing, to put the theory behind the practice. So I completed my liver care of liver patients course, again at KCL. My mentorship course, obviously we have to have that. I did my neurosurgical course, research, all these other things I completed while I was there. And then I was, like I said, promoted to assistant there. Then from there, I moved here part-time because I wasn't quite sure. I'd never worked in the private sector before. A friend referred me here and I trusted him really well. So I came sort of part-time to sort of feel my way around HCA, liked it, and then moved over completely in August of 2016. So I worked here up until September 2020 as a senior sister in the PICU. And in late August, my previous matron, he resigned. So I went for the job and, successfully was appointed. So next slide, please. So the challenges that we faced, there was a lot going on. So you can imagine we were, right in the middle of the pandemic. So we had staff members that were sick, and in fairness, some of them are still getting over long COVID. We didn't know what it meant, and because there was going to be such a sharp staff shortage, the decision was made to move all of paediatrics from Harley Street Clinic to the Portland. So that in itself is challenging. You had people who have worked in the same place for 35 plus years, and all of a sudden they've been uprooted and moved somewhere else. And on top of that, to ensure that we could continue the cardiac program for the many patients that were the Harley Street clinics, we had to get everything in place to be able to support that. And in order to support that, to my, it's been a good thing, but at the time it was my horror, that we had to extend our beds fairly quickly. I thought that, for a long time at the Portland, we were okay. We always had spare beds. And all of a sudden, in March, we were looking at having to turn away cardiac cases. So we then took 5 beds on the 5th floor, which is the floor directly underneath, and put our lower acuity patients there to free up our surgical beds. And to be honest, I thought that it was going to be a temporary measure, but we've been full practically all the time. So it was a good move. So we have been and still are supporting the NHS surgical list, which covers the spinal surgery, urology, and some of the like cleft palate patients who've got cleft palates, who have when they come to me, is if they have, you know, something extra with their airway that they're concerned about, then they would come to the ICU. And then, like I said, we've got the cardiac program, which has remained a success, and that's been really good to be able to keep that going for the nurses that came in from Harley Street, who were primarily cardiac trained, so their skills are not lost, and we didn't lose those nurses. In terms of challenges faced, you know, I mean, my family's not young anymore, but to be honest, you know, they still need me, and trying to juggle such a busy unit, you know, the things that come up, you know, supporting the team, supporting the staff, ensuring that we have robust protocols and everything in place. It can be hard to juggle it with my family. I'm not quite sure how I'm doing it, but it's happening and I'm doing it. But they haven't complained. But it's been a challenge, but a good challenge. Next slide, please. So my key milestones, I think, being the first student to gain a permanent position in Piku without having to go rotation at King's, that was really big for me. One of the senior nurses who works in King's College Hospital, but she's also a lecturer at King's College Uni, she came to find me and said, "Oh my gosh, you've made history here. This has never happened." So that for me was a really a key thing, because actually it's meant that people coming behind me now, if they have a real passion for Piku, they don't have to go and but go somewhere else for 6 months and then come there. They can actually go and be grown and be taught things straight away. Also, I'm very proud that I became the Piku matron. I love my team. We're like a little family, and like all families, we have challenges, but we always make it out the other side. So I'm not ready to put my hat up yet. You know, we all get on. And I think my favourite thing now is we are just about to launch the preceptorship programme. And although there was a preceptorship programme written already, I wasn't happy to launch that because we didn't have a second clinical practice facilitator to support that. And I really believe that a nurse, a brand new nurse at the first year of their career, really needs to be supported. So now we have, in fact, I need to start interviewing next week, because we've just closed the post, the what's it called? The advertisement for a second CPF, which means that come September, I'll be able to give a 3rd-year student that we have now the same opportunity that I had to be able to come straight in and start their journey. So that really makes me happy. And I think that's mine. Next slide. Okay, so advice. So I think be open to change. In any case, all medicine, nursing, everything is always changed. So I think it's inevitable, so just embrace it. I think in those tough times when you're wondering, oh my gosh, what am I doing? I think you just need to remember your why. Why did you start this job? Why did you come into this profession? You know, I would hope that everyone that's coming into this profession is coming in primarily because they care about patients and they care about people. So remember your why, and that will always get you out of bed in the morning and a Sunday evening when you don't want to come in for a medi match. So just look after each other, and just like you would a patient. I think it's really important, and I really believe as a manager, if you look after the staff will look after the patient. Absolutely. I mean, I didn't make that up. That was a Richard Branson thing, but I like it. So that's that. And I would say, don't stop, keep going. You know, to be honest, nursing, the sky's the limit. There are so many doors that can be opened from nursing. If you had asked me at the beginning when I was a student, like I said, I started this journey wanting to be a health visitor, I would never have thought I'd be a PICU manager at the end of it. So it's got so many avenues that you can go in, and I feel like I'm just starting my career. Actually, it's not ending; it's starting. So keep going. That's me, I think.
Yay. Right, I'm Karen. I am the matron for the inpatient wards. So I look after a couple of wards on the pediatric services. So we have the outpatient, the inpatient, which we have 3 wards. One of the wards is the complex care and the neurosurgical long-term patients. The other one would be the surgical complex patients. And we have got the day cases, but it's not under my remit. And we have got the UCC and children's outpatients as well. So I'm only looking after the inpatient areas. So at the time when I write this, I think we also have a group of site practitioners who are on site 24/7. So I do provide support to them as well. And these are the group of people who who are really there for our patients and staff who needing any sorts of like clinical advice or any related work advice, really, not necessarily staff advice. So so who do I normally work with? I mean, I work with the ward managers very closely. I mean, the CNSs is our group of people that we work quite closely with, because they are the one who have a caseload of patients. They will come to us to ask about, if we could accommodate them on the floors, if they could accommodate them on the Piku. The matrix is also important. I work closely with Lorraine because, like what she said, my patients goes to her area, then subsequently they come down to us. And then the international office is our pivotal actually point of contact for all the Middle Eastern patients, isn't it? Because we deal a lot with them at the moment as well, and HCA concierge managers or the nurse specialists, and mainly consultant and surgeons as well. So just a quick review on the neuro rehab and the complex care ward. So we've got 13 beds on the neuro rehab complex care. It's currently being refurbished, and we have got an inpatient gym and a sensory gym currently built on the floor, so which is a really nice unit. So the floor will be opened properly and fully at the end of August this year. So the complex surgical ward, we have got 6 dedicated adolescents ward, really, for adolescents undergoing spinal and orthopedic or cardiothoracic surgeries. And then the 4 of the other beds on the ward are catered for all sorts of other surgeries, not necessarily, reconstructive types. And additionally 4 on the 5th floor, which we could be a flex floor, really. Sometimes we put cardiac patients in there and other patients going reconstructive surgery, such as the palate and lips that we talk about. Next slide, please. So I have been in nursing for a very long time, 20+ years, and I started my career in nursing in Singapore, and I graduated in 1999 with a diploma. And when I graduated, I mean, it was a general diploma. And I have no inclination of where I was going to be put in a department, like what Lorraine says. She knows what she wants to do from the beginning. Fortunately, I was given the pediatrics, which I know that I was it was a mismatch of my training, really, because I was trained in general adults with ICU and oncology. When suddenly I've been put to pediatrics, I think my world did come to a topsy-turvy, and I remember crying for a week, but I picked up my courage and I moved on, and I did manage to complete my nursing degree along the 4 years when I was in Singapore, and I did a top-up, really, and then that carries me through to see, like, in my general nursing career in general, sorry. And then I thought that, I decided to come to the UK to see what is it like to do nursing in the UK. And I was recruited for, at the time when I was in Singapore, I was in the oncology, and I did a lot of bone marrow transplant, pediatric bone marrow transplants, and well, really oncology related, oncology, hematology related patients and cases and things like that. So I was interviewed by the Portland Hospital for the role of the oncology nurse. So I came here in 2003. We did oncology, solid oncology only. And the oncology service was then moved to Harley Street in 2007. So whilst I was here in with the Portland, I did my conversion course. The conversion course is really, if you are the registered general nurse and to become a pediatric nurse, you need to complete that course. So I did that in 2005, and I was really fortunate enough, and then I got a degree in children's nursing within the year. And from there, it's just history. Really. So I'm still here. So I got promoted to the senior status in 2006. In 2010, I became a ward sister, and then I became a senior ward sister in 2017. And in 2019, just before the pandemic hits us, I was promoted to the pediatric matron, but at the Harley Street. So between the 2006 and 2010, I started a family. So I had the opportunity to take a year-long maternity for both of my children, which is really, really lovely. Throughout the year of my career with the Portland, and I've got, plenty of opportunities to develop, really. There's lots of in-house training, management training, advanced pain training, everything that is related to my career. And I managed to complete this whilst I was here at the Portland. Thank you. Next slide, please. So I think I have got lots of challenges. I think you've got challenges when you're a nurse. I think, when you come so far, 30 odd years, one of the challenges I can remember is actually in the UK, pursuing a career still as a staff nurse, and I secretly aspired to be a ward sister, and I asked about the career pathway, what is actually required to be a ward sister, hence, the reason why I pursue the conversion course, because it's a requirement for a ward sister to be, one of the requirements to be a ward sister is actually an RSCN qualification. So that's where I did, I took the decision to take the course, the young long course, to pursue the RSCN qualification, so to enable me to become the ward sister, which I had in was a couple of years ago. Yes. So, and then the other bit would be the going to the oncology. I was hired as an oncology nurse, Portland, in 2003, and when the oncology moved to the Harley Street, as you can see, you can imagine how it felt when you are left, when your service moved, but you are still with the Portland. It's a really hard decision for myself, because I'm not quite sure whether, should, for the many years that I've done oncology, should I move to Harley Street, or do I stick with the Portland? Because, Portland offered at the time other surgeries, not just oncology, and other sort of medical complexities that we see every day as well. So it was a really hard decision, but I stick to the gun, and I stayed at the Portland because I thought that it's time for me to step out of my comfort zone and embrace what Portland can offer. And I think Portland did offer me a lot of opportunities, I must say. And I think the most difficult challenges I've faced, I think probably for you as well, Lorraine, is actually the COVID. When the COVID peak hit us, I think around February 2020. I think it was when, like what Lorraine said, when we have to move, when we were in Harley Street, we have to move all the pediatric services from the Harley Street to the Portland. And it was a very difficult for people like us at the time. For me, definitely, because I have to now think about my staff, the services that I've moved, which at the time, Harley Street was doing oncology and cardiac services. So we were thinking of how we moving the patients, relocating the patients to NHS services, moving staff. So I think that was a very difficult time for us, because yes, it's not easy. And definitely when staff come to a new area, familiarization with the environment, getting to know the other team, settling in, people felt a bit displaced, they'll be like, oh, I don't know what we're doing here at the Portland, because as you can see, the services that we, or the things that we do at the Harley Street is different from what we do at the Portland. So I think it was difficult to settle everybody in. Certainly that, I think, for me.
We find out the other side, I think.
We come at the other side of it eventually, yeah. Next slide, please. So my career highlights really, it's actually becoming a ward sister, like I aspire to. And at the time, between 2006 to 2010, I also had the opportunity to also help the pediatric bleeds, and also the ward sisters also having taken on another additional role, which is the pediatric site practitioner. So we do hold the bleeds regularly. So I think that was quite I would say a highlight, because being ward system, doing the managerial, some part of the management bit, and in being a pediatric site practitioner doing the clinical bits is actually quite rewarding, because you don't get to do things in tandem, but there's an opportunity to separate these two roles together. So it's a highlight for me. And like what I said there, lots of scenarios. And then I think lately for us, I must say, when the HCA were awarded the NHS contracts, from the list, Evelina, Barts, LUWH, Imperial, St. George's, Chelsea West, King's and Oxford's. I think it's something to be proud of, isn't it, Lorraine? I mean, when all NHS has put their surgeries on hold and we take them on board, I think that was quite a challenge, getting everybody, all staff sign off, and getting them all to be geared up to do this kind of all the surgeries that's coming in. I think that was quite a feat, really, to be honest with you. Yeah. Right, next slide, please. Right, so advice to anyone who wants to join, who wants to be a PEDS nurse. I think Lorraine has said that, keep an open mind. I think sometimes, I think nursing is always changing. Sometimes when you thought that you are settled in place where you could be comfortable, I think there's always a good thing to pursue other avenue, to see what other areas are like, because it's ultimately it's what you want to do at the end, to be honest with you. And nursing is such a wide I would say a world and so many things ongoing, and enough to keep you going, to be honest, isn't it?
Yeah.
Definitely. And be passionate with what you do. I mean, there's a difference between passion and interest. I mean, interest doesn't last long. Passion is like a fuel, isn't it? This is like, it's in you. I think if you, as long as you have the passion, it keeps you going, and you will, hence that's why I'm still here 20 years on, because of the passion in what I really love doing in nursing. Perseverance is one thing. You have to persevere in times of adversity, and this is especially true when COVID hit us hard 2 years ago. I think perseverance also applies to all of us. I think when you start a family, or when you have got an exam in your first interview, it's really important that you persevere. And I think last but not least, I think caring. I can't stress enough, is an essential thing that you must have in nursing. I think it's not just being caring. I think it's the application. It needs to be in you. It's the embodiment of nursing, really, so that you could carry out your job, and you could be, you have the passion, you have the caring, and that's what keeps you going and be a good nurse.
Yeah.
And I think that's it for me. Thank you.
Okay. That was brilliant. Thank you both so much for presenting that to us today. I think we'll start on the questions that we have. We have a few at the minute, if you're happy, Lorraine and Karen, to answer these. Yeah. We'll start with the first one. Someone's put, what is the best route? So Lorraine, obviously, I understand you said how you started your nursing initially with the intention of going into health visiting, but then you later progressed into Piku as you loved that. So what's the best route, or your advice for a nurse to start in the best route, whether it be adult nursing or peds, if they want to work in Piku specifically?
So if they want to work in Piku, if you are RGN, you have to have an RSCN qualification. And
Okay.
that was at HCA. It's down to the Care Quality Commission, so CQC. So we can only, we have to have paediatric nurses, and that's their thing. So when we merged, there were some of the Harley Street nurses that had general training and hadn't been able to go on their conversion. So I'm in the process now of putting them on their conversion course, but I can't employ any more because we have to keep the paediatrics. So I would say the first thing would be to try and get your RSCN, or depending on where you trained, because we've just had contact with an agent in Portugal, and there's a nurse there, and he thought that he didn't have the right qualification, but actually he did, because when he went to apply to the NMC register, because he had done the extra paediatric course, that enabled him to be on the paediatric register. So I would say, sometimes, although the main registration is RGN, some people have never ever worked with an adult. Their whole training is with paediatrics. So if they've done specialised courses, sometimes those courses are recognised by the NMC. But really, to work on my unit, you have to be RSCN.
Okay. I think you've explained that really well. And in doing so, you've answered another question that was put in about, does doing adult nursing limit your opportunities if you later want to go into peds? So you've explained that really well. Okay, this is directed towards Lorraine again. Someone said, what made you come to the Portland? I think that they've tried to write. And what was the biggest difference you found between the private sector and the NHS? So
I had a friend that was telling me about it the whole time. One of my best friends, actually, and he said, look, just come and try it, you never know. And they came over, and I just feel, for me personally, I mean, I worked with, like I said, the team at King's from a student all the way up. So it was a very difficult decision, but at the time for me, I felt like I was giving more and more, at that time getting less and less. So it's not knocking the NHS, because at the end of the day, they made me the nurse that I am. I trained with them and all the rest of it. But in terms of my family life, in terms of my work-life balance, I got a better work-life balance when I came here, and that was the decision for me, really.
Okay. And transferable skills from Piku. I understand you've explained a lot about what you cover, especially at the Portland, and what you've covered in your previous Piku experience. But if you move abroad, or vice versa, people have done Piku abroad and want to come to the UK, are there transferable skills there, would you say?
Of course. I mean, dealing with an arterial line is dealing with an arterial line, whether you're here or on the moon. So there are always transferable skills. Anybody that comes to my unit, they work closely with the CPF, with their team leader, now buddies as well, and they have to be signed off with their competencies, because I mean, we have to make sure that people are safe to work with patients. So it's not, and also if people like, we just had someone who's really knowledgeable, but the way that they did things in a different country is completely different. So we just have to knowledge, and the skill is there, but the way we do things here in England is just different. So we're just supporting them through that process. So I wouldn't want anyone to be put off by that, because the whole point of having clinical practice facilitators, and in my team, we have 2 band 7s per team to care for their team. And on top of that, we've now added in a buddy for new people to work with each shift to support them. So I wouldn't really think we just come and get let loose. That's not getting good for us as it would be for them. So we're not going to say, oh, because your skills are where forever, we rubbish them. We just need to assess and see where they're at.
Okay, that's very good. Someone's asked, what development progress is available for pediatric nurses at Portland? So obviously you've explained your journey and how you've progressed to Piku, but I guess they're just asking specifically at Portland what courses you offer, I guess maybe to get you into Piku, or what you offer whilst they're on Piku.
So for Piku, So anyway, for peds anyway, so if there's any courses that they want to do that are external, so we are linked with King's College, LSBU, and a couple of others. So, and to be honest, even if it's a university that we're not linked to, we just need to know about it so we can get a contract with them. If they offer an obscure course that is not somewhere, but realistically, it has to help the unit or the business. And so we send people. I just literally sent 2 girls on the high dependency course. So yeah. So for people who are on the ward, for instance, want to upskill, even though they may not want to necessarily be in PICU, that's what I'm saying. We work close together. We rotate people. So we even had one of your nurses who did the high dependency course. He came up and did shifts on our ward so that he could get familiar, and now he get the skills that he needs as well, isn't it? Exactly. So with the second CPF, we want to be able to do that. So it's not just a case of Piku, but anyway, for Piku specifically, you can do the high dependency course, which is an external course, normally with LSBU, so London South Bank University. And then there's the PICU course that is offered now. We go with the King's Health Partnership because it's recognised by the PIC standards, and also now we have before at the Portland. So the patients cohort has changed drastically in the last 2 years. So the patients we had were quite long term, complex needs, but quite not the high acuity I was used to in King's. That trajectory has changed now. So because of that, we are now able to get our nurses to go to the KHP, the King's Health Partners PICU course, which means that they're often doing it less because they have exposure to level 3 patients where that wasn't the case before. So we had to send our nurses away for longer so they had exposure to the patients to be able to complete the course. Now we have those patients here, we can send them away so they can see and be assessed by somewhere else and see how another unit works. And that's going quite well. We've got 2 girls going off in September for the PICU course.
That's amazing. Okay, brilliant. That's lots of great information there as well. Thank you. You've answered another question as well, with someone had asked, do Portland have links with other universities and teaching hospitals? I think you've explained all that in what you just summarized now. For both of you, how do you keep your clinical skills up to date as being in senior roles, i.e. as matrons, when it will be assumed that you're not hands-on or on the floor as much?
Well, I do clinicals. I mean, we are clinicals most of the time. I think Lorraine working on a unit for myself. I sometimes hold the bleep regularly. I think when you hold the bleep, you are the site practitioner for the day.
Yeah.
The emergencies, clinical things on the floor, people ask you to kind of review pain, to kind of review wound, removing dressing, removing sutures, all sorts of people are actually hands-on. So I get the opportunity to do that every month. I think for yourself to do
the same. So basically, our it says matron, but our actual title is clinical nurse manager. So actually, I did more clinical in the pandemic than I did anything else.
Yeah.
And even now, if we're short, the ratio of agency to core staff would be a little bit off. Rather than do that, either myself or my deputy will go and work clinically. So we still do the 2-day, European Pediatric Support. We do all of those clinical courses as well, because and to be honest, I quite like clinical, so I like to still be able to go and dip my hand in and keep my skills up. So and there's always an opportunity to do that. So we're not hands-off managers.
Okay, brilliant. Some nurses are skeptical about the private sector. You having said that you came from the NHS to private, both of you, and these nurses believe that some believe that you can't progress as you do in the NHS. What advice would you give those nurses, given your own experience in both sectors?
I think it depends what they want, what you want to do. So, one of my nurses has come back to me and said that she's got an interest in tissue viability nursing, and so I've just put in I just put in for approval, the application for approval to send her to KCL London, King's College London University, to do her course. So I think that the opportunities are there if you ask for them. So, you know, every single year we have to do a training like trajectory for our team, where we look at what skills people have, what they could do, and what they want to do. So, you know, there are things that they have to do anyway. So there's the mandatory trainings that have to be done, and competencies that have to be done. So there's no choice in those. But for people that want to expand their learning, they just need to ask and tell us. So
yeah, we do that in our appraisals, don't we?
Yeah.
And our yearly appraisal, we sit down with them and talk about if there's anything they like to pursue in their career.
Yeah.
Well, you know, once they've done that every year or anything like that. So
yeah. So it comes out in their appraisals. I forgot that. Yeah, we discuss it as well. For me, the sisters discuss it with their team, and then they feed that back to me.
Okay.
The courses that they want to do, and then but actually I have to say it's on the employee to find the course. If they say I want to do whatever course, I'm not going to go look for that. They have to come to me and say I've seen the courses in XYZ. Here's the paperwork. Put it in for approval. So you know, yeah, they have to be responsible for. I won't remember. I've got 46 staff. I won't remember everyone that wants to do each individual course. They have to, you know, be accountable for their own learning.
Okay. Staying within that same topic, we have another question. So having moved from the NHS to private sector again, someone's asked, in terms of work satisfaction, what were the biggest challenges, pros and cons? I understand you said obviously the Portland tailored more to your work-life balance, but was there any other pros or cons that you might want to highlight?
I think for me, I can say that for me it's training. You get trainings. You know, obviously you have to fulfill a couple of I think a year, isn't it? When you're here, you can do trainings relevant to your work area.
Okay.
Opportunity to have with private sector, the NHS way longer. Whereas in Portland, once you are established and then you are doing where you're working actively in your area of respiratory course to help you to progress further, to care for the patients that you are actually working with. So career progression, definitely education.
Yeah, I mean, I think when I wouldn't have necessarily, when I was in King's and I was quite senior before I came here, I still couldn't see myself as a matron then. So, and yet here I am. So, I think that, like I was saying, I had to be accountable for my own progression. You know, I could still be, you know, the post came out, it's up to me whether I apply and go and, you know, look at the job description to see if I meet it. So I don't think that there's been a lack of job progression for me. I think the only thing in terms of for our staff, obviously for everybody, the pandemic halted things a bit, but even then we were paying for courses that were being purely delivered online. So that didn't stop anything.
Okay, that's good. Someone's put for Karen specifically, do you take, so Lorraine, I understand you'd said in the presentation about some of the nurses be qualified enough or in the process of potentially starting on Piku at Portland directly straight after their training. For Karen, do you take newly qualified nurses on your wards, and what support is available for those nurses?
So I will start to take the newly qualified. Surgical ward. I think we can take a newly qualified, but I think once Lorraine's the second CPF is joining us in September, we will be able to go comers and start them in the preceptorship program as well, along with the preceptorship, because we have got the support for that. Yeah. So
the answer is
yes.
Yes.
Okay, that's great news. I think you've practically covered this as well, but what courses do you recommend to keep up with your CPD? I understand you guys said you still work clinically on the floor, even though you're both senior, but any courses you'd specifically recommend, I guess, for pediatric nurses or nurses in Piku?
Well, you need to have your mentorship. But
Yeah.
that's changed now, isn't it? It's not a university
It's not
based
university
anymore.
based anymore. So
Yeah.
I think we I mean for us, I mean CPD courses is actually lies with our the area of our work currently now as well. I think as we are, you know, we have both in clinical and management. CPD courses related, management related courses is certainly helpful. I think for people who joined us, there are internal programs run by our learning academy. We have in-house programs, you know, for newly qualified or who's not been, you know, like looking after children with long term, for example, complex healthcare needs. We've got courses with tracheostomy run by our own in-house training.
Okay.
So this is one of the examples, but we certainly have a lot of courses.
And there's an in-house
training
leadership program.
Indeed.
So that people can start, and you have to do your modules, and it's recognised and all the rest of it. So even if you're starting as a staff nurse, and you're thinking, and even if you're thinking, you know, beyond senior staff nurse, whatever, you can start doing the modules for the leadership pretty early on. So you're getting that under your belt. So when you're ready to progress, you already have an idea of what you're progressing to. So yeah, there's a mix of, you know, like I said, we support external courses, but there's also a large amount of in-house.
You're right, like the recognized ILM courses.
The ILM courses, what I was thinking about.
Yeah. People who like to pursue the management course, they go to the ILM and then they get a diploma, and then you know, get from the business school, is it London Business School? So it's a recognized qualification. So definitely there are CPDs, there are some courses out there that.
So to summarise, you know, if you're looking after patients that so I've just sent 6 people on a cardiac course, because of course, like I said, merging the unit, we have half the team that are very au fait with cardiac, and some that are not, and also the cardiacs may not be very au fait with the neurosurgical. So we are paying for a lot of training and courses. So 6 people have just gone the Brompton course for congenital heart something, I can't remember the word, the title. But anyway, it's with Brompton and Evelina, like I mentioned, and so they're doing that. So you need to look at the cohort of patients that you're looking after and go on the courses. If you're not certain about something, if you're, I'm not sure about wound care, then go on the wound care course. If you're not, you know, if you want to be able to cannulate, then put into to do the cannulation course. So there are the opportunities there. They just need to look at and identify with their team leaders what the learning needs are and what their interests are.
Okay, so there's loads, actually. There's loads of opportunities. For you both, given how far you've both come on your journey, and you said that it's kind of just the start of your career still, as you have loads to learn, and what's the next step for you both career-wise?
We are definitely pursuing the master's degree.
Yeah,
that's our next step now.
Yeah,
go all the way up. That's how you know.
Yeah.
Wherever it takes us, we do not know. That opportunity always lies ahead of us. So I think for myself and Lorraine, we did talk about it. I think the next step is a master education, you know, in whatever we're pursuing, and you know, see where it takes us. I mean,
who knows?
Early days.
Like I said, 2 years ago, I didn't think I'd be the matron of my unit. So who knows?
That's amazing. I don't think this is so much, but it's someone's asked, do you have a nursery inside your hospital? I'm assuming they're saying Portland specifically, for the staff, especially those working that have young children, mums and dads. What could you recommend?
At the moment, we don't. Sorry, I don't think we've ever had that, have we? So we don't. There might be. I mean, I don't know, but thinking back to when my son was younger, I don't know if they still do them, but there might be some kind of help from the government that helps with nursery. But obviously, I know that's difficult because of shift work. So
yeah. No, that's fine. Another lady's asked, you mentioned that the patients you see have changed a lot since COVID due to merging and taking on NHS patients in that time. What is your primary cohort of patients on Piku currently?
So I would say on the 5th floor it would be I say it's a mix because so we have like cardiac patients that we fix their heart, they go home. Then you have others that we fix their heart, but they've got an airway issue, so then they have to have their airway reconstructed. So although the primary issue was the heart, now we're dealing with their airway, and then they stay with us for longer. So we've got a mix of long-term complex patients who may have originally come to us for their cardiac surgery. Some of them are for like seizure control. We have lots of spinal, but they're like our quick turnaround patients. They come in for one or two nights and go. So I think our main would be cardiacs at the moment.
Okay.
I didn't make it. My ward clerk made a really nice presentation with over the last quarter and what kind of patients did we see, and the highest is spinal. Our spinal surgery is coming in and out, and then down is cardiac.
Amazing. Okay, so primarily cardiac and spinal, but you have a lot in and around that too. Okay, amazing.
Neurosurgery, craniofacial. So, and that's like a new avenue of patients that have started to come. So, yeah.
That's amazing. Okay, so a lot of variety of exposure for pediatric nurses or anybody working in Piku. Amazing. Yeah. Shani, I think you have a couple of questions. I'm going to hand it over to you and then to close up.
Thank you so much. So I've got a private message from Grace. I am originally an international nurse. I'm now registered as an adult nurse. I have worked in neonatal. How do I now get a job in pediatrics? So she hasn't got the experience in pediatrics, but she's got it in neonatal. So what's the switch there?
So her registration is RGN?
Yes.
So you wouldn't still need you still need your RSCN.
RSCN. And if she has experience in neonatal, is it easier for her to get a job in pediatrics, considering she's already got neo experience?
I think this is something that we need to address it with our. Can we take contact and ask and get back to her? Only because I think I know for sure when I spoke to Dawn, our neonatal matron, she was certain that anyone who wants to work in Piku needs to have an RSCN qualification. You know, again,
you have to. The thing is, it's not us rubbishing people's experience. It's literally we have to adhere to the CQC guidelines
and MC as well.
And MC. So you know we have to make sure on the shift that the patients are being the patient cohort, which are pediatrics, are being cared for by pediatric nurses. So you know, if I had, I think I've got about four nurses now that I still need to put on conversion course. 2 should be going, hopefully. If not, we can't get them on this year, it'll be next. And then the last 2. So when you're looking at it like that, then maybe you can be a little bit more flexible. But the problem is, when you put someone on a conversion course, they're gone for the whole year. So we have to backfill that person. So it's just so much easier if they already come with that registration. But it's not, like I say, at the moment, I just can't because I've got 4 people to send off already. I would need at least 2 of them to be gone, and then I'd have to discuss it with my boss really to see if we're allowed to do that in terms of the CQC.
Absolutely fine. Thank you so much. Lorraine and Karen, I'd like to say a huge thank you from MediMatch and all the team for presenting and answering various questions. Rosanna, thank you so much as well for hosting. and all of our attendees. Thank you so much for joining as well. If you have got any questions you would like to ask Lorraine and Karen afterwards, please feel free to let me know and I can pass the message on for you. Karen, Lorraine, is that okay if I be the mediator for you both?
Yeah.
Perfect. Okay, well, again, thank you so much for joining. This has also been recorded. So if any of your friends want to watch, please feel free to message my email address. I'll add it into the chat box now. So just send me an email if you've got any questions and if you would like to share the recording link. And yes, thank you so much for joining. And Lorraine and Karen, thank you again so much for taking time out of your Sunday.
Thank you both. Bye.
Thank you so much. Thank you. Have a lovely evening.
Bye.
Bye.